it's finally time to roll out the BBraun Infusomat Space IV pumps. I know it's been a while since you guys had the initial training on the pumps, so let's go inside the unit and do a good refresher on how to use this great little device. The IV pump brackets are now firmly installed in all the units, a very good quality design. You can see it has a hexagonal bar, so you can firmly attach the pump bracket to it. It has the power cord, which will be permanently attached to the bracket, and you can see it runs down the back wall of the action area and plugs in to the converter. When attaching the pump to the bracket, we want to make sure you rotate the clamp 90 degrees from where it is now. Then you could attach it to the clamp. Remember to plug in the power cord first, just so you're not trying to fumble around back there after you get it attached to the bracket. So we want to clamp it down to the hexagonal bar in the bracket. Righty-tighty, lefty-loosey. Make sure we get a good snug fitting on there so that the pump doesn't vibrate down from the movement of the truck and the idling of the engine. So that's how we attach it to the bracket. When it comes time to use the pump, you have options. It's always good to have options, right? Whenever you want to unhook the pump or use the pump, always remember to unplug that power cord first. So let's reach back and unplug that power cord. Now you can either take the pump off the bracket or remove the whole bracket itself. Let's talk about both. To remove just the pump, you can release it from the bracket, pull it out. Now you can hand it to your partner to get it set up for you. You can get it set up, whatever the case may be. If you want to remove the whole bracket, just unscrew the handle, opening up that clamp. Now you can have the clamp attached to the pump, attach it to the IV pole, and you're ready to go. Once you get your drip all set up, you can hook it to the IV pole. We recommend, if you're going to attach the clamp to the IV pole, that you use the lower part of the pole where it has a bigger diameter. It'll be a little sturdier for you. So go ahead and attach the clamp onto there, tighten it down. Should be plenty of clearance from your patient. You can point it whatever direction you prefer. Go and hook up your set to your patient, hit the start button, and you're ready to go. Attached to the end of this video will be the initial training videos that you guys saw. I want you to watch those just to refresh your memory on how everything works. Before we get to that, I just want to hit on a couple points that weren't covered in those videos. Since the initial training, there was an update to the pump. When you turn the pump on, it's going to power on, go through the setup process. It's going to ask you to open the door to insert your pump tubing. So we insert the tubing. And we close the door. It's going to ask you original space line, which is yes, what we're using. It's going to remind you to keep the roller clamp closed, and then to open the roller clamp before you hit the start button. Now, it's going to ask you if you want to disconnect from the patient before priming. If you prime the line like you usually do, then you're going to skip this step. Of course, we don't want to prime 25 cc's of the medication out of the bag after we already set it up. This step is for if you didn't prime the line before putting it into the pump. But what my recommendation is, we're creatures of habit as paramedics. We use a lot of muscle memory. We do things in repetition. So you're going to set up this bag like you always do. You're going to spike it and you're going to prime it. So I recommend that we don't start priming our lines this way using the pump. So let's skip this step. So down arrow for no. Do we want to go into the drug library? Up for yes. Manatee County EMS. Now we're within the drug library. So let's just skim over the drug library very quick. We have our KVO setting. Remember again, the KVO setting we can hook to any patient with a 1,000 bag and to do a 20 cc per hour KVO saline setting. We have our Emulator drip, Emulator Infusion, cardizem, dopamine, lidocaine, mag sulfate, adult asthma. Of course, we don't have a protocol for this. If you want to utilize this protocol, please call for orders prior to doing that. We have our mag sulfate drip, which is if you convert a person in torsades, that's the maintenance drip to do so, which is in our protocol. Magnesium sulfate OB. This is if we were ever to do a high-risk OB transport from Manatee Memorial Hospital. This is their high-risk OB protocol for mag sulfate. Again, we would not be using this setting without a doctor's order. We have the nitroglycerin drip programmed into the pump for future use. And then our pediatric lidocaine. So that's a brief review of the drug library. If you have any questions, please contact one of your training lieutenants. The other variation since the last programming of the pumps is you have options now of when you want to go into the drug library. You can go into the drug library prior to inserting the line or after, and I'll explain that. When you turn your pump on, it's going to go through the self-test process. Then it's going to tell you to open the door and insert the line like I initially showed you, or you can press C to enter parameters. When you press C, it's going to take you right into the drug library. So you can go into the drug library first if you'd like to. Dial up your medication. Say you want to give an Emulator Infusion. Then you can open the door, insert your tubing, close the door. It's going to ask you original space line. Keep the roller clamp closed. Then open it before you hit the start button. Of course, we want to skip this step because we've already primed our line. Attach our line to the patient. Open the scroll lock. Then hit the start button to start administering the medication. So those are the only slight changes in the pump since we did the last training. Now watch the other two videos and get yourself reacclimated with the pump. Alright, to give you guys a quick little rundown of the BBraun Infusomat Space IV pump. It's very simple, very user-friendly. When it's charging in your truck, you're going to see this screen, the charging screen, your battery status, Manatee County EMS, and turn pump on. It even tells you which button to push to turn the pump on. So turn it on. It's going to make a little beep. It's going to do a little self-test, and there's a couple screens in the self-test. This is the first one. Then it's going to go to another screen that talks about line, date, and time. Then it's going to go to an airline screen. This is all part of the startup process. And then once the self-test is done, it's going to go tell you to open the door. And you need to open the door to put the tubing in. And to open the door, you push this button on the far right here. And it's going to ask you, do you want to open door? And if you notice these little arrows next to the yes and no, all the interaction with the screen will be done with these four buttons right here. And it's very user-friendly. And it'll tell you up for yes, down for no. You push up for yes, because yes, we want to open the door. Once the door is open, you can load the tubing. The tubing is going to look like this. It's going to have this first plastic piece with two holes in it, a second piece with the little hooks on it, and the third piece is the lock. So it can only go in one way, so you can't do this wrong. Put the first piece in, the second piece with the little hooks, and then the third piece will be the locks. And just slide that in there, and it will click, and then there's another little notch over here for the tubing to go into. Once the tubing is loaded, you can close the door. This actually takes a little bit of pressure to close it. Just push it till it clicks, and then the machine will take over and close it the rest of the way. And then it's going to ask you original space line, which is referring to the original manufacturer's line, which this is, and it's the only line we're going to be using. So again, it prompts you to push the arrow if yes. And then it's going to go through a couple other screens. The clamp should already be closed after you clear the air out of the line, and it's going to remind you to open the clamp once you're done. And that's referring to these clamps here, of course, which you're familiar with. Then it's going to ask you if you want to go into the drug library. Yes, because that's where all our medications and drips are. So push, again, little arrow up for yes. And it's going to say Manatee County EMS. Yes, and again, gives you a little arrow prompt. Now it has all our drips pre-programmed in here. It has a KVO drip just for just normal KVO purposes. Then it has Emulator drip, the infusion, the Cardizin, dopamine, lidocaine, and then our pediatric lidocaine drip. So if you want to do your Emulator Infusion, again, you scroll down to it, and you can see the little arrow there, push to that direction, and everything is pre-programmed in here. From this point, the only thing you have to do is hit start. That's it. Everything is already pre-programmed into the pump. The only time you're going to deviate from that is with your weight-based drugs, which would be dopamine and your pediatric lidocaine. So in those instances, go to the drug library, up for yes, EMS, go down to your dopamine, over arrow, and the weight screen is going to come up first. So if your patient is 80 kilos, 80 kilograms, click OK to confirm. It even tells you that on the top of the screen. Now it does all the math for you. At this point, all you need to do is hit start. And then once you hit start, if you need to titrate, you can see next to the number 5, your 5 mics per kilogram per minute, there's another little arrow, and then you can push that arrow and up your dose. And you go 6, 7, remember your range is 5 to 20, and click OK to confirm, as it tells you right there. And that's it. That's all you need to do for the dopamine. Very simple. The pediatric lidocaine is the same way. Go to the drug library, EMS, go down to the pediatric lidocaine, over arrow, enter the weight, say they're 20 kilos, click OK to confirm. Everything is done for you. Just hit start. Pediatric lidocaine is administered at the proper therapeutic dose. Very user-friendly, very efficient. If you don't get the opportunity to do set up a lot of drips and you just want to be able to use the pump to get familiar with it, you can hook it up to just a regular IV line and just do a KVO setting. Again, to do that, go into the drug library, up for yes, EMS, little over button, KVO, click OK, and it's already set at 20 cc's an hour, a KVO rate. Hit start, and the pump will do the rest for you. When it's time to take the tubing out of the pump, whether you've arrived at the hospital in the back of the truck, or remember the pump is portable, so you can take it inside with you. But whatever the case may be, when you need to take the tubing out of the pump, just make sure you stop whatever drip is going. Then you're going to hit the open button over here. And it's going to prompt you whether you want to open the door, little up arrow for yes. And the door's not going to flop all the way open this time. It's going to open partially. And then you can pull the door open, because as you're doing that, it's going to pull this little lock out. Then you push this green button down, and that's going to release the lock from the mechanism, and you just pull the tubing out. That simple. Then you can just close the door again. Remember, a little bit of pressure. It'll do the rest for you. And then you can power it down by holding the power button for 3 seconds. Now it's powered down. Okay, some other key features of the BBraun Infusomat IV pump are the bracket that it comes with. It has this nice little carrying handle, and it also has this little bracket piece back here so you can hook it to the IV pole. Remember, you don't have to hook it to the IV pole. You can take it off of the bracket, and you could essentially place it between the patient's legs. It's light enough and small enough that you could place it on the patient's lap. So if you want to do that, you want to take it off the bracket. You have this button back here, and then the bracket itself. So you push down on the bracket and push that little button. The bracket will slide right off, or the pump will slide right out of the bracket. And if you notice the two channels on the side, that's where the pump slides in. So slide in, take it off, push the white button and down on the bracket, and it'll slide right off. So that's how to use the bracket. Okay, another question that you may have is, where do I hang the drip once I get it mixed up? And you have a couple options. The easiest option, I think, is once you hook this to the IV pole, you just hang the drip on the IV pole. Or you can hang on one of the little ears here that are on the pump. You can hang it there. Or you have another option. As long as you get all the air out of your bag, you can essentially place it anywhere. And you may ask, well, how do I do that? Let me show you. So you have your 250 bag or your 100 bag, whatever the case may be. You unzip it, pull it out of the package. You put in your medication, your Emulator Lidocaine, dopamine, whatever the case may be. And once you inject it in there, you mix it up, you pull the tab, and you can see in here, there's lots of air trapped in there. And to get that air out, you need to pierce it. So take your drip set, take the cap off. You want to pierce it so air can escape. Once it's pierced, all you have to do is squeeze all the air out. Once all the air is squeezed out, now you can pierce it again. Then run the solution through your drip set, get all the air out of the line, and after that, you can essentially, once there's no air in the bag, only your medication in the D5, you can essentially set this anywhere. You can set it on the patient's lap, next to the pump. You can still hang it if you want. You can place it on top of the pump. But now you have a lot of options to place the bag once you get the air out of it. But remember, it's important that the air is out of the bag before you do that, or you're going to get an alarm within the pump. It's going to tell you you have air in the line. And if that happens, I'm going to show you what to do. Alright, I'm going to talk to you guys about some possible alarms that might come about with the IV pump. And one of those alarms would be the air in the line alarm. And another alarm you might come across is an occlusion in the line alarm. And I'm going to show you how to deal with both of those. So first of all, let's load up our drip. Let's open the door. Of course, remember, it asks you, do you want to open it? Up arrow for yes, like we learned earlier in the video. So open the door, reload the tubing. Make sure everything's in place. Close the door. Now, original space line, yes, that means we're using the original manufacturer's line. Arrow over. And it's just going to remind you to keep the roller clamp closed and then open it when you're ready to start the drip. And I purposely did not bleed all the air out of this line when I set it up so we can trigger that alarm so I can show you what it'll look like and what it'll sound like and how to deal with it if you come across it. So we picked our Emulator Infusion out of the drug library. So we're going to click Start. And the infusion's going, and there you get the air bubble alarm because we have some air in the line. And it's going to make an audible alarm as well as a visual alarm. And it's going to say click OK to confirm. Once you click OK to confirm, It's going to tell you to disconnect it from the patient, which you need to do before you prime it and get the air out of it, because you don't want to introduce air bubbles into the patient's IV site. And then this screen is going to come up, prime line 10 cc's. 10 cc's is the default amount of fluid the pump's going to prime your line to get the air bubbles out. You don't have to go through the whole 10 cc's. Just keep an eye on the line. Once you see all the air bubbles are out, you can stop it. So prime line 10 cc's, up arrow for yes. It's going to prime the 10 cc's. Let it go as long as you need to get the air out of it. Once it's out, you can click OK to stop prime. You don't have to go through the whole 10 cc's. So click OK to stop prime, and then now you can hook it back to the patient and hit start again to go right back into your drip. So that's how you deal with the air and line alarm. Another alarm that you guys could potentially encounter with the BBraun Infusomat Space IV pump is what's called the pressure high alarm, or basically the occlusion alarm. If you get an occlusion somewhere on the line, it's going to sound an alarm. And as you can see, we have our Emulator Infusion going here. And I'll duplicate the occlusion alarm simply by closing the scroll lock. And when I do that, you'll see the pump's going to sound an alarm, and it says pressure high, which means there's an occlusion in the line somewhere. And you can also see it says OK to confirm. But don't click OK to confirm until you troubleshoot your line and figure out what caused your occlusion. Whether the patient is sitting on the line, or maybe they bent their arm, or maybe somebody stepped on the tubing. Try to troubleshoot what caused the alarm before you click OK to confirm. And in this case, it was because we closed the scroll lock. So we'll open the scroll lock, clear the occlusion, click OK to confirm, and then just hit start again to resume your Emulator Infusion or whatever drip you're given. So that's how you clear the pressure high alarm or the occlusion alarm. Another alarm you guys may see on the pump is what we call a pre-alarm, and the pre-alarm just goes off whenever the pump sits idle for a period of time. Like in this situation, I went into the drug library, I've dialed up the Emulator Infusion, but I haven't hit start, and the pump's just been sitting idle for a few minutes, so you kind of get this reminder alarm that goes off. It'll flash a yellow light just reminding you that, hey, I'm here, I'm ready to go. Are you going to do something with me? Maybe you forgot to hit start on the infusion, so it's kind of a good thing. So if you're going to use it, hit start. If not, just turn the pump off. If you don't want to turn the pump off, if you think you're going to need the medication in the very near future, you can just cancel the alarm, and it says OK, cancel alarm right at the top, so just click OK. But remember, again, after the pump sits idle for a short amount of time, it's going to set off that pre-alarm again. I hope you guys enjoyed the training put on by the Manatee County EMS training department on the BBraun Infusomat Space IV pump. I think you'll find this to be a highly effective tool in the treatment of your patients. Thank you. One additional piece of information I want to share with you guys is that once we get the IV pumps on board, we're no longer going to be using the Select 3 IV drip sets. We're going to be carrying 3 sets of IV tubing on the truck. You're going to have your pump tubing, which is for the pump. You're going to have a 10-drop set, a flush set, or trauma tubing. If you have a patient that you need to give fluid boluses to, you need to do it through a 10-drop set, because the IV pump has 1,000 cc an hour max, and it's not fast enough to give fluid boluses, hence the 10-drop set. Then we'll be carrying some 60-drop sets. Well, you might ask, why are we carrying 60-drop sets if we have the pump? Well, if you have to do 2 drips at once, or in the event that the pump fails, we have to have a backup. So that's why we'll have the 60-drop sets. Again, if you guys have any questions about that, please let training know. So how do you guys feel after watching those short videos? I hope you feel good and confident about using the pump. If not, that's okay. Let us know and we'll get with you. Our recommendation is, once the pumps are put onto the trucks, the first few calls that you have, use them in a KVO setting to get that tactile feel and refamiliarize yourself with the pumps. I hope you find them a great addition to your paramedic toolbox, and I hope you enjoyed this video. Take care.